few minutes to see how the artificial intelligence can pitch in the CBC reporting itself. So the Sukra has got a product which is called as the SAIL, and which helps in making sure that the artificial intelligence has been put into practice itself. Most importantly, it is able to get us the numeric values, the digital imaging, as well as the histograms, as well as that of the scatter plots. And it will be easy for any of the laboratories, 24 hours, they can go ahead and use this for the computational methodologies for the digital imaging, including histopathology and imaging from the cytology also. And here we'll just see how the product goes. So the SAIL has got all this like pre-analytical interferences or expired analyte calibrations, QC bracketing, critical results, abnormal results, delta checks, and clinical decision supports, which are all actually important in our laboratory practice itself. And how does they help in CBC reports? So if you take the software, which is a product of the Sukra, they have got data like this on your screen, which helps us in the clinical decision support system. So they have got the RBCs and the RBC indices, gives you a bold ups and lows, as well as it helps us in saying what is the picture problem over here, which says that microcytosis with heterocytosis, even without seeing the peripheral smear. It's not that this is reliable, but at least it sensitizes the reviewer before signing this out itself. So here we have one more case where you have got an interpretive remarks. This is again by the artificial intelligence and the clinical decision support system, where it says that microcytosis with erythrocytosis is evident. Suggested microscopic examination and a hemoglobinopathy screen. As we said, we have to screen for both the RDWs as well as that of the MCVs itself to differentiate between the iron deficiency anemia and the thalassemias itself. So here you have got the MCV to be low, then RBC being high, though the hemoglobin is around 13.1, and they use a clinical decision support system algorithms based upon the international guidelines. It's not that the data board and artificial intelligence has been done like that. It's been having a traceability to that of the international guidelines also. Now we have got one more case where the WBC count is very high with neutrophilia. So if you see here, the WBC count is high, which shows that you have an arrow mark which says that it is high. Neutrophils, absolute neutrophil count being high, and differential count showing the lymphocytes to be low. And it indicates also that there is a leukocytosis with neutrophilia. And let's see the interpretive remark. It says very clearly that neutrophilia is evident, suggested microscopic examination for the confirmation. So the softwares which are available in India are able to utilize the artificial intelligence in the pathology practice, and the laboratory can also utilize these clinical decision support systems which are based upon the artificial intelligence dashboards which are made. This can also be customized to the customer, and then we can go ahead with the utility of the software itself. So you have one more case where you have got a low hemoglobin. Look here, you have a low hemoglobin here, then 11.2, RBC is low, then PCB is also low, the indices are there, and you have got a normochromic normocytic RBCs with the low hemoglobin, and anyone can guess that it could be a normocytic normochromic anemia, where you can have interpretation with that of the clinical chemistry parameters also. So you have got certain indicators visually also, like if you see here on the extreme right-hand side, you have got turnaround time, whether it is upkept, and you have got overall status also, you have got circles, which indicates that this is neutral, has got some abnormality, high values or a low values itself. And you have got the differential count in one of the cases to be having a high lymphocytes over here. So you have a WBC counts with neutrophilia you have got. And when you look into it, you also get neutropenia, which is evident in one of the cases, which suggested a microscopic examination itself.